If you are over 60 and you have been getting an annual blood test that includes a creatinine number and a GFR estimate, and your doctor has been telling you that your kidneys are fine because both numbers are inside the normal range, I need you to sit down and listen carefully. Because the test you are relying on, the standard creatinine and the eGFR estimate based on it, was developed in the 1970s and was designed for the average 40-year-old patient. It was never designed for an aging body with reduced muscle mass, slower metabolism, or the specific changes that take place inside the kidney after the age of 60. There is a second test available at almost every laboratory in the United States that is dramatically more accurate for adults over 60, and that detects early kidney damage years before the standard creatinine test catches it. Your doctor has almost certainly never ordered it for you. Most have never been trained to think about it. I'm Dr. Richard Foster, and in the next 18 minutes, I'm going to walk you through exactly what this test is, why it matters more than the creatinine test for everyone over 60, and how to ask your doctor to order it for you in a way that gets a yes. I'm going to give you the 5 hard truths about Cystatin C, the test that nephrologists themselves request when they are tracking their own kidney function. You'll meet 3 real patients whose Cystatin C numbers told a story that creatinine alone never could. And by the end, you will know exactly what to ask for at your next appointment and why your insurance is almost certainly going to cover it. Before we go any further, one important note. Nothing in this video replaces the advice of your own doctor. The information here is meant to inform the conversation with your physician, never to replace it. Cystatin C is a clinical laboratory test, not a treatment, and the interpretation of any kidney test belongs in the hands of a trained physician who knows your full medical history. If you are in stage 4 or stage 5 chronic kidney disease, are on blood thinners, ACE inhibitors, ARBs, or diuretics, please continue working closely with your nephrologist on every aspect of your care. Now here is the truth that few doctors have the time in a 12-minute appointment to explain. The standard creatinine test measures a waste product produced by your muscle cells. The more muscle you have, the more creatinine you produce. The less muscle you have, the less creatinine you produce. After the age of 60, the average adult loses 3 to 8% of their muscle mass per decade, a process called sarcopenia. As your muscles shrink, your creatinine production falls. Your blood work shows a low creatinine. Your doctor calculates a normal eGFR. And you walk out of the appointment believing your kidneys are healthy. Meanwhile, the kidneys are quietly losing filtration capacity, and the test you are relying on is blind to it. There is a name for this phenomenon in nephrology research. It is called creatinine blind spot, and by some estimates, it conceals early kidney decline in roughly 30 to 40% of seniors over 60. Stay with me until the end, because truth number 5 is the one that will change how you think about every blood test you have ever taken, and the one that explains why thousands of seniors are walking into dialysis units every year, having been told for a decade that their kidneys were fine. Truth 1. Creatinine lies as your muscles shrink. The first hard truth is the most important one for you to understand. The creatinine test is not a direct measurement of your kidney function. It is an indirect estimate, calculated from how much creatinine your body produces and how quickly your kidneys clear it. The math depends on the assumption that your muscle mass is stable. After the age of 60, that assumption breaks. Your muscle mass is not stable. It is falling year by year in nearly every adult who is not engaged in resistance training. And as your muscle mass falls, your creatinine production falls along with it. Your blood work shows a deceptively low number, and your eGFR, the formula based on that number, produces a deceptively normal result. A landmark study published in the Annals of Internal Medicine in 2012 evaluated over 4,000 adults over 65 and compared their creatinine-based eGFR to a more accurate measurement called iohexol clearance, which is the gold standard reference for true kidney filtration. The study found that creatinine-based eGFR overestimated true kidney function by an average of 9 to 14% in seniors with reduced muscle mass, and in some elderly patients, the overestimation exceeded 20%. That kind of error is not a minor inconvenience. It is the difference between a senior with stage 2 kidney disease being correctly identified and treated, and the same senior being told everything is fine, while their kidneys quietly progress to stage 3 or 4 over the next 5 years. I think of Eleanor, 71, from Asheville, North Carolina. She had been seeing her family doctor every 6 months for 9 years. Her creatinine numbers had stayed between 0.8 and 1.0 throughout that decade. Her calculated eGFR had hovered between 68 and 74. Her family doctor had reassured her, year after year, that her kidneys were fine. When she came to me with vague symptoms of fatigue and ankle swelling, I ordered a Cystatin C. Her result came back with a Cystatin C-based eGFR of 46. 46. She was not in early decline. She was already in moderate stage 3 chronic kidney disease, and the standard creatinine test had been hiding that truth from her and from her doctor for nearly 9 years. Truth 2. Cystatin C does not care about your muscle mass. The second hard truth is that Cystatin C, the test I want you to know about, is fundamentally different from creatinine. Cystatin C is a small protein produced by every nucleated cell in the body, meaning every cell with a nucleus, which is the vast majority of cells in your body. Its production rate is essentially constant across age, sex, and muscle mass. The kidney filters it out of the bloodstream at a steady rate, and the level you measure in the blood reflects with remarkable precision how well your kidney's filtering units are actually working. Because Cystatin C is not produced by muscle, it is not affected by sarcopenia. It is not affected by whether you have lost 20 pounds of muscle since age 65. It is not affected by whether you eat a high-protein diet or a low-protein diet. It is not affected by whether you ate red meat last night before your blood draw, which can transiently elevate creatinine. The number you get from a Cystatin C test is a far more honest reflection of what your kidney is actually doing inside your body. A 2019 systematic review published in the Clinical Journal of the American Society of Nephrology analyzed data from over 40 studies and concluded that Cystatin C-based eGFR is significantly more accurate than creatinine-based eGFR in adults over 65, in patients with reduced muscle mass, in patients with chronic illness, and in patients undergoing significant weight loss. The same review found that Cystatin C detected early stages of chronic kidney disease 2 to 4 years earlier, on average, than creatinine alone. 2 to 4 years. That is the difference between a senior who can change their diet, modify their medications, and protect their kidneys before serious damage takes hold, and a senior who learns about their kidney disease only after dialysis is on the horizon. Pause for a moment. I want to ask you something. When you went to your last physical exam, did your doctor explain in detail the limitations of the creatinine test in older adults? Did they offer you a Cystatin C as an alternative or additional measurement? If you are like nearly every senior I have ever met in my office, the answer is no. Most family physicians order what their electronic medical record system orders by default. The default is creatinine. Cystatin C requires a deliberate, separate order, and most physicians have not been retrained to consider it routinely after 60. They are good doctors. They are simply running a system that does not flag this test for them. Few doctors have the time to explain. That is the reason this channel exists. If what you're hearing is opening your eyes, please tap the like button. It tells YouTube to put this video in front of other seniors who right now are walking around with a falsely reassuring creatinine number and have no idea that a more accurate test exists. Now let's keep going, because truth number 3 is the reason that nephrologists themselves order Cystatin C on their own blood work once they pass the age of 60. Truth 3. Cystatin C predicts heart disease, stroke, and mortality better than creatinine. The third hard truth is that Cystatin C is not just a more accurate kidney test. It is one of the most powerful predictors of overall health outcomes in adults over 60. Full stop. Multiple large studies have shown that elevated Cystatin C levels predict cardiovascular events, strokes, and all-cause mortality with greater precision than creatinine, even in patients whose creatinine appears completely normal. A study published in the New England Journal of Medicine in 2005 followed over 4,000 older adults for 8 years and found that those with elevated Cystatin C had a 55% higher risk of cardiovascular death, a 42% higher risk of stroke, and a 73% higher risk of heart failure compared to those with low Cystatin C, even when their creatinine was within the normal range. Read that again. Even when their creatinine was normal, an elevated Cystatin C still predicted serious cardiovascular outcomes years before they happened. The reason for this is that Cystatin C captures something the creatinine test simply cannot detect. It captures subtle, early changes in kidney filtration that signal vascular dysfunction throughout the body. The same forces that damage the kidney's microcirculation, high blood pressure, oxidative stress, endothelial dysfunction, low-grade inflammation, also damage the heart, the brain, and every other organ. By the time creatinine begins to rise, those vascular forces have been at work for years. Cystatin C catches them earlier, often by 2 to 5 years, and gives you a window of opportunity that a normal creatinine result would have closed. Robert, 68, from Phoenix, Arizona, came to me with a normal creatinine, a normal cholesterol, well-controlled diabetes, and a vague sense that something was wrong. He had been told by 3 different doctors that he was healthy. I ordered a Cystatin C. His level was elevated. His Cystatin C-based eGFR was 49, putting him in moderate stage 3 kidney disease. We added the dietary changes from earlier videos, removed the ibuprofen he had been taking 3 times a week, started him on the hibiscus, ginger, and lemon tea, and tightened his blood pressure target. 3 years later, his Cystatin C had improved. His blood pressure was lower, and his cardiologist documented 0 progression of plaque in his carotid arteries. The early signal from Cystatin C had bought him a window of 3 years to act. The creatinine test would have taken those 3 years away from him. Truth 4. Cystatin C costs almost nothing, and most insurance covers it. The fourth hard truth is one that surprises almost every senior I tell. The Cystatin C test is not exotic. It is not expensive. It is not experimental. It is a standard laboratory test available at every major laboratory chain in the United States, including LabCorp, Quest Diagnostics, and most hospital labs. The list price ranges from roughly $15 to $40, depending on the laboratory and your location. Most insurance plans, including Medicare, cover Cystatin C when it is ordered with an appropriate clinical indication. The most common indication that gets the test approved is documented chronic kidney disease, suspected chronic kidney disease, reduced muscle mass in an older adult, or a discrepancy between a patient's clinical picture and their creatinine result. In other words, almost any senior over 60 has a defensible reason to request this test, and almost any insurance plan will cover it when the request is properly documented. The barrier is not financial. The barrier is awareness, yours and your doctor's. Most physicians will order what you ask for, especially when the request is reasonable, evidence-based, and supported by guidelines from the National Kidney Foundation, which now formally recommends Cystatin C as a confirmatory test in adults whose creatinine-based eGFR is between 45 and 60. When you go to your next appointment, the conversation can be straightforward. You can simply say, I am over 60. My muscle mass has decreased over the past several years, and I would like to confirm my kidney function with a Cystatin C test in addition to my standard panel. Most doctors will agree without resistance. If your doctor declines, ask them to document the reason in your chart. That request alone is often enough to change the answer. Margaret, 66, from Tampa, brought my video to her primary care physician 3 years ago. He had never ordered a Cystatin C in his career. He listened, looked at her muscle mass, looked at her creatinine of 0.95, and ordered the test along with her annual labs. Her Cystatin C-based eGFR came back at 53, 15 points lower than her creatinine-based estimate. She was in early stage 3 kidney disease, and neither of them had any idea before the test was done. Today, 3 years later, her doctor orders Cystatin C on every adult patient over 60 in his practice. One conversation, one test, changed his entire approach to senior kidney care. Truth 5. The combined Cystatin C and creatinine eGFR is the most accurate test in modern medicine. The fifth and most important truth is the one almost no senior has ever been told. The most accurate measurement of kidney function available outside of a research laboratory is not Cystatin C alone. It is not creatinine alone. It is the combined eGFR, a calculation that uses both Cystatin C and creatinine together to produce a single, far more accurate estimate of your true filtration rate. The combined formula is officially recognized by the National Kidney Foundation and the International Kidney Disease Improving Global Outcomes Guidelines as the most accurate, non-invasive estimate of kidney function in clinical practice. A 2020 paper in the New England Journal of Medicine compared creatinine-based eGFR, Cystatin C-based eGFR, and the combined eGFR in over 12,000 adults, and found that the combined formula reduced the average error of kidney function estimation by roughly 50% compared to creatinine alone. 50%. That kind of accuracy improvement is rare in medicine, and it is freely available today at every major laboratory in the country. All you have to do is ask for both tests at the same time. When you ask your doctor to order a Cystatin C, ask them to also include the combined eGFR calculation in the report. Most laboratories will produce it automatically when both tests are ordered together. The result will give you the single most accurate picture of your kidney function that current medicine can offer outside of a hospital nephrology department. It is the test I order on every patient over 60 in my own practice. It is the test nephrologists order on themselves. And it is the test that, for reasons of habit and inertia, most family physicians have not yet started ordering routinely. I think of Harold again, the 72-year-old man you met in an earlier video. When he came to me with a GFR of 31 based on creatinine, his creatinine was concerning but not catastrophic. His Cystatin C, however, told a far darker story. His Cystatin C-based eGFR was 26. The combined eGFR was 28. The creatinine had been hiding the severity of his decline by roughly 5 filtration points, which in clinical terms is the difference between a senior who has time to intervene and a senior who is approaching a dialysis decision. The combined test gave us a much more honest baseline. From that baseline, we built the recovery plan that has stabilized him for the past 2 years. So let's bring this home. 5 truths. The creatinine test lies as your muscles shrink. Cystatin C is independent of muscle mass and far more accurate after 60. Cystatin C predicts heart disease, stroke, and mortality better than creatinine. Cystatin C is inexpensive and almost always covered by insurance. The combined Cystatin C and creatinine eGFR is the single most accurate kidney test in modern outpatient medicine. Each one of these truths is supported by major peer-reviewed research. Each one is reflected in the official guidelines published by national and international kidney organizations. And each one is almost never explained to the senior sitting in the exam room with their lab results in their hand. If you took only one thing from this video, let it be this: the creatinine number on your last blood work is not enough. After the age of 60, you owe it to yourself to ask for a Cystatin C, and to ask for the combined eGFR that uses both tests together. The conversation with your doctor will take less than 5 minutes. The text itself takes a single tube of blood, and the information you walk away with may give you years of warning before a problem becomes a crisis. Eleanor learned the truth 9 years late. Robert learned it with 3 years left to act. Margaret learned it because she brought a video to her doctor and asked the right question. You can be the senior who learns the truth this year while there is still time to do something about it. Here's what I want you to do this week. Pick up the phone today and call your primary care physician's office. Ask the receptionist to schedule a follow-up appointment for a kidney function review. Bring this video with you, or bring your own bullet point list with these 3 requests written down. 1. Please order a Cystatin C blood test. 2. Please order it together with my standard creatinine panel. 3. Please calculate and document the combined eGFR using both results. Most physicians will agree, most insurance will cover it, and the result may quietly change your life. And remember, your kidneys have to last you another 30 years. Take care of them like the precious, irreplaceable organs they are. If this video helped you, please share it with one person over 60 in your life, a spouse, a sibling, a neighbor, a friend from church. Most seniors are walking around with a falsely reassuring creatinine number and have no idea that a more accurate test exists. A single share from you may give someone the early warning that protects their kidneys for the next decade. Right after this video, I'd like you to watch the next one in this series. It's called the 30-second morning mistake that's damaging your kidneys after 60. Once you have an accurate measurement of where your kidneys actually stand, the next step is identifying the daily habits that are quietly accelerating their decline. And the very first one happens within 30 seconds of waking up. The link is on your screen now and pinned in the description. I'm Dr. Richard Foster. Take good care of yourself. Your kidneys still have many good years left in them. I'll see you in the next video.